Hello, I'm Ameneiros, and I have the pleasure to present this study case of evaluation of computed tomography in patients with atypical angina or chest pain, clinically referred in invasive coronary angiography. This is a randomized controlled trial. More than 2 million normal coronary angiographies, such as this one, are performed in Europe each year, and there is an ongoing search for non-invasive gatekeeper that will reliably exclude normal invasive coronary angiography. The CT non-invasive alternative is the most accurate non-invasive test for the diagnosis of obstructive coronary artery disease. The greatest clinical value is to reliably rule out disease in patients with atypical angina or chest pain. Now talking about the randomized study, patients with suspected coronary artery disease owing to atypical angina or chest pain in the clinical indication for coronary angiography. They randomly assigned to CT. The result is the 167 patients. How we can see here. How we can see here, the blue, and the undirect coronary angiography, the result is the 162 patients. E como se undou acá? Yeah. Now talk about the reduced need for angiography. It was a reduced need for angiography shown in red in the CT group with only, I need to learn to use this, with what I was talking, with only 14% receiving, 14% receiving invasive angiography after CT, as compared with the whole 100% in the direct angiography group. Now the undo. Now talking about the greater diagnostic yield in the CT group. The diagnostic yield defined as the proportion of invasive angiographies with obstructive coronary artery disease, showing purple or blue, was great in the CT group 75%, then in the direct angiography group only 15%. Now some additional findings. The additional findings of this study were major procedural complications that were uncommon in both groups, while minor procedure complications were less common in the CT group. There was 3.6 versus 10.5%. Also, the CT shortened the median length of stay by 22.9 hours, and also the radiation exposure was similar in the two groups. Also, after a median follow-up of 3.3 years, no difference in cardiovascular events was found. And to finalize, 75% of patients would prefer CT for subsequent testing. That is all. Thank you for your attention.